Hi Mahesh, how are you? Mahesh, am I audible to you? Is my voice is audible? Alright, Chatura, sorry I got disconnected in between. The network was bad. So guys, my comment middle where? You can connect me with video, Mahesh. In chat, I will not be able to understand what you're trying to say. Middle where? What do you mean by middle? Hi Nitin, how are you? Long time. Is it better now? Okay. So, guys, as you're aware that I'm here to discuss uh, things related to mental health. It's been 2 long years, and we have been struggling with sometime COVID-19, then COVID-20, then COVID 2021, different versions. So I understand many people might be undergoing different things and different situations. So I would like to first understand what all things you have been experienced and what kind of difference you have you know um, had happened between 2021 and 2019 and 2021. So based on that, if you have few questions, we can proceed. It will be the moral of this live connect was to understand what kind of situation people are going through, and it's always get to talk about what situations you are in. Maybe any of us will be of some good help and will be able to help each other. Hi Shabnam, how are you? Good to see you. I hope you're doing good at Himachal, and hope everything is good over there. I've been seeing your pictures, they're wonderful. So I will be really interested, if somebody has a few questions to ask, so that we can, start from somewhere. So okay. Meanwhile, people join. Let us try to understand what exactly mental health is. It's a very big topic to discuss about. Generally, mental health is a combination of emotion and your psychological well-being. So if you're uh, you know if you're able to balance your emotions as well as your psychological health, that then it is always said that your mental health is absolutely fine. When there is an imbalance between emotions and your psychology, means your thought process, then we say that we have some kind of mental health. So let us try to understand the mental health. The When we are physically not well, then we go to a doctor and get ourselves treated with physicians or a different kind of doctors. But when we have a problem related to our brain and our thought process, then we go to a mental health specialist. So many of us, even the education, people who are well educated and well wised, don't know what exactly the basic things where people have faces towards the mental health issues. So let us understand. So, like I said, balance, a perfect balance of your thought process and emotions is related to mental health. So having a good mental health always help you to lead a healthy and stable life. So if you're mentally sound, you will be able to take good decisions. If you're mentally emotionally stable, your decisions will, most of the decisions will be accurate and will give you a very good result. Your health and your life will be perfectly balanced, and you will be having no issue. Probably you will be able to control over your life. So it helps you to demonstrate and realize an ability to cope up in the face of life, phases of life. So like I said, it all, when you're mentally sound, emotionally stable, you will be able to take your decision independently, and you will not be having any kind of problems in your life. Now, there could be many reasons a person can suffer from mental illness. It could be genetical factor, it could be environmental factor. They are the two major factors which disturbs your person's life. If it is genetical, it's coming from your people, from your hereditary, and it's been passed from generation to generation, and you'll have to deal with it and understand how to live with that kind of problem. Environment is a kind of situation which gives you which develops the problem inside you. For example, you're working in a corporate sector. I'm sure Abhishek will be able to relate. He is from IT sector. So if a person, he is from IT sector or from MNC or from education sector, and he is having a very stressful life, he is very busy, he does not have a social life, and always 24 by 7 he is working, and he doesn't have a family life, and particularly so that which will always create a very high level of stress. When he has a high level of stress, his life, he will be having BP issues, he will be having other anxiety issues, he will be having headache issues, he will be having body issues, other issues will start developing. He may his sleep will not be sound. So that those kind of environment factors, when they stress on your life, then they create an imbalance in your both both kind of lives, your professional life and your personal life. So how do you there are different strategies that can help you to establish a good mental health. So out of which one very important factor is keeping yourself positive. अच्छा सोचोगे अच्छा होगा. So if you always keep your line, if you keep yourself alive in a very positive note, you will think that everything. It does not. I do not say that just do positive thought and do nothing. Think positively and start working towards that positive direction. Do not demotivate yourself. Always and always think positive, and always try to find an alternative ways when there is one with in Hindi we said एक दरवाजा बंद हो जाता है तो दूसरे पिछले 4 दरवाजे और खुल जाते हैं. So it is very very important for you to keep your alternatives ready, and always ready to fight. Life is all about winning a war. So if you have a situation, understand the situation, see the positive aspect to it, and start focusing towards it and working towards. If you keep your if you see a problem, you develop a negative attitude, you will not be able to rise, and you will not be able to get towards a solution anywhere close. So it's very very important for you to have a positive approach even in the worst scenarios. The second thing is that it's very very important for you to be physically active. you should have a very good physical you should be doing very physical activities like exercises or small yogas and all meditations and all, so that your body, even if you have a prolonged disease, even with the minor physical activities, you will be able to overcome different problems in your life. For example, if you have stress, lot of stress in your life, you do breathing exercise frequently and you see the difference. So the second and third most important thing is that a proper sleep. You should get a proper sleep. It is very important for the people who work in MNCs, who have night shifts or rotational shifts working around. They get a sleeping pattern disturbed. So most of these people, if they don't take care of their sleep, which is 8 hours sleep is very important. If they are not able to do that, they will develop problems like insomnia, computer syndrome, where they will develop a lot of issues related to neck, cervical and pelvic spondylitis can happen to them. So it is very important that you get your 8 hours sleep, whether you sleep in the night or you sleep at the day, based on your work life. But it is very important that you take your 8 hours sleep daily. If you are not able to do that, it is going to come back and bite you very badly, not only to your physical health but to your mental health also. So it has also been found that people who do lot of hard work, and they don't do proper sleeping, or they don't do or they don't sleep properly, means even if they are sleeping not in a right direction, like for some people take a lot of pillows, some people do not take a proper posture while sleeping, they develop a lot of cervical problems. So many of us who has a lot of long sitting hours, like 8 hours, 9 hours, we completely sitting and working on system, we don't stretch or we don't move, we develop stiffness of muscles, and that stiffness of muscles always create poor circulation of blood in body, resulting in lot of too many body pains. So it's very important that you eat right, you sleep well, and you take a positive approach towards your life. Then it's when you're facing some kind of problem, like for example there's a trauma in your life, or you're undergoing a traumatic situation, which you're not able to deal it. It's always better to reach out to someone whom you can talk it out. If you sulk a problem inside you, or if you bear keep on putting the problem inside your heart and you're not taking it out, it is going to create a problem in your life. It can lead to any kind of problems. It can relate to your heart problem, it can relate to your brain problem, it can relate to your thought process so it's very important that you whenever you have a problem in your life which you are not able to deal with, it's okay to ask for help. There's no shame in asking for help. So when you think that I'm not able to cope up with this particular kind of problem, this is a very big issue for me. For other person it might be a small issue, but for you it might be a very big issue. So it's very important that you take a professional help, and you consult a right person for your help, for the help. And there is no shame in that, because if you keep yourself confined towards yourself, it is not going to take you anywhere. You will not going to able to find a solution for it. Remember, every problem does not have a solution. There are some problems in your life with which you have to deal with it, and you have to work with it parallelly. So as a common person, you may not be able to find a solution for it, how to live with it. So it's always better you move ahead and ask for a professional help, which they are concerned people, they are trained people, and they will be able to guide you properly and proceed further and help you out in coping up with this kind of problem, or or that kind of situation in a better manner. Now, when we talk about, this is a pandemic situation where people are not socializing much. They are confined to one particular place. We are facing lockdown. We are facing, house arrest kind of situation. It's for our own good, for own, safety. However, man is a social animal. They need to get socialized with people. Okay, fine. You're not able to communicate with the people outside the house, but you are able to communicate nearby, or you can communicate with people with maintaining social distancing. So it's always very important to socialize with people, keeping the current COVID norms in mind. So, like for example, you will not be able to touch people, or you will not be able to, that cordial, that the way you were in, before 2019. But you will still be able to talk to people. You will still be able to communicate people over virtual medium, like we are doing it. We will still be able to talk to the people on phone or live chats, or those, where you can communicate, hey, this is my problem, and and I'm feeling this way. Or you can have a day to day talk. Fine, you cannot hang out outside, but you can talk to people. So that does not mean that you eat up other person's mind for talking for hours and hours. But yes, you are a socialized person, so you need to talk to some different people among, outside your house. So it's always, you can choose any kind of medium, like a phone or chat or computer, or talking to people with a safe distance. These all things you can use for socializing yourself, and and can make your life comparatively better. And you can, when the more you talk to your close friends, apart from your family members, the more lighter you may feel. Like it will be the same kind of feeling that, no, I am not alone in this situation. We are all are in the same situation. So one may be having a different problem, other person may be having a different problem. When you discuss about it, who knows that a middle solution comes out. Whereas if you keep the problem up to yourself only, and the other person keeping the problem himself only, they will sulk in their both domains, and bhala kisi ka nahi hoga. So it's always important that it's a crisis time, it's a COVID time, that it is very very important for everyone. Physical presence is not important, so at least give a virtual presence. Even at times, people who are suffering from COVID disease or any kind of disease, you are physically not present, but if you're calling to the person, you're continuously in touch with the person, it gives a positive attitude, and the person gains a confidence. Yes, I can do it, and I can fight for it. So it's all about having a right attitude. I can do it, and I can fight for it. But that comes when somebody is positively motivating you, not negatively motivating. Like there's a difference in saying that if somebody calls and says, I am COVID positive, and other person reacts, oh my god, you're COVID positive, you have to be isolated, you have to be and you throw him with all kind of negative information. That person is already scared, and you're three times scaring the person more. That is not going to help. Rather than you'll say, no, okay, COVID positive hai, you give positive things. I am there with you. What kind of support you want food, you want any kind of help, I'll provide it to you. Any alternative things we can do for you to help. Those kind of things, if is coming towards from your friend or your family members, that will itself give a very positive charge to a person, that I'm not alone, there's somebody apart from my family who's helping me out, and I'll be able to come out of it clean. So बहुत ज़रूरी होता है कि जब आप पॉजिटिव चीज़ें इंसान को बोलो इस सिचुएशन में, नेगेटिव चीज़ें तो बहुत सारी इंसानों के अंदर आती रहती हैं. सो पॉजिटिव जितना आप उसके द मोर पॉजिटिविटी यू ट्राई टू स्प्रेड ऑन द पर्सन और द पीपल हु आर सफरिंग फ्रॉम एनी काइंड ऑफ डिसीज, it will help the person, fighting back to the disease. So it's very important what you talk and how you talk with the person. So this is going to help. Now, what are the factors which include mental health problems? Mental illness can be influenced by four major parts. One, it can be genetics. जेनेटिक्स से भी हो सकता है, लाइक मैंने जैसे पहले बोला था, पीपल डिसीजेज लाइक स्किज़ोफ्रेनिया, bipolar disorder, or different kind of diseases, they can be transferred from heredity to heredity, one generation to another generation. And like I said, first environment, कि अगर आपका environment stressful situation का है तो आपको mental health problems आएंगी. आपकी डेली हैबिट्स, आपकी रोज़मर्रा की हैबिट्स क्या हैं, आपका स्लीपिंग पैटर्न क्या है, कितने बजे उठते हो, कितने बजे सोते हो, क्या एक्सरसाइज करते हो, क्या खाते हो, व्हाट ऑल द थिंग्स आर इन योर लाइफ, आर यू एडिक्टेड, आर यू नॉट एडिक्टेड, जो भी आपकी डेली हैबिट्स रहती हैं वो भी एक इम्पॉर्टेंट रोल प्ले करती हैं आपकी मेंटल हेल्थ की कंडीशन को. देन the fourth pillar comes for the biology, like आपका state body कैसा है और आप किस तरीके से, for example दिन में एटलीस्ट 1 to 2 liter water is very important for you to drink, but you don't drink water at all, then it will cause a lot of problems related to water deficiency in your body. The 70% of your body is water. If your body is not getting that, then you will have related issues. You need to have balanced diet, and you need to have different kind of vitamins, A, B, C, or E, or K, which are responsible for different activities in your body. If they are not coming in right proportion in your body, they can cause a lot of problems in your personal life. So it is very, very important that you have a balanced diet, and there must not be any kind of deficiency in your food. If you're having a good food leads to a good health. If you're eating a lot of junk food, or if you're eating a lot of things which is not healthy, which is unhealthy, at the same time you're not working out, then it is not going to help you. It is going to create a lot of problems in your life. Now there are different mental health disorders, like I spoke. The more common are bipolar disorder, persistent depressive disorder, generalized disorder, which is commonly known as GAD, and there are many major depressive orders like MDD, which is called as major depressive disorders. These are all big terms, I know, so I'm not going to go in detail, but I will try to put one or two lines. Another one is OCDs, obsessive compulsive disorder, or PTSD. Many of us go through from PTSDs, like which is called as post traumatic disorder. Schizophrenia, which is also one of the most common. Then social anxiety disorder is there, and these are the very common names I spoke about. Now let us try to understand what these things are about. So if you talk about bipolar disorder, bipolar is a very chronic mental illness, and it affects, if you pick up the statistics, every 2.6% of Americans every year, percentage of their population get suffered from bipolar disorder. So it is characterized by episodes of energies. So there will be high and lows in person's mood. Sometimes he will be very energetic, sometimes he will be very, very lazy and lethargic. He will have his own mood swings. Then this is in general, but that does not mean that it's confined to this much only. There's a graph, maniac graph बोलते हैं जिसे, it's a sinusoidal graph, and it is divided into bipolar 1 and bipolar 2. Now coming out to another very important disease, which is called as persistent depressive disorder, which is also a chronic kind of depression. It's a one of the category of depression. So it is also called as dysthymia. So while a disemitic depression, it is not that intense, but it can interfere in your daily life. So people with this, experience, with this condition experience symptom for at least for 2 years. So at least 2 साल तक तो ये चलता ही चलता है, and every 1.5% of American population undergoes with this kind of experience. So now इंडिया में भी बहुत सारे होते हैं केसेस. देयर यू विल फाइंड अराउंड 5 to 10% केसेस कमिंग आउट ऑफ depression. And mind you, when you are feeling low, it does not mean that you are depressed. So there are different symptoms and signs with which you will be able to understand actually going through depression or not. You have to get yourself your brain EEG done and different kind of tests which have been done to find whether you are undergoing depression or not, because there are few neurotransmitters whose deficiency, like serotonin and all, whose deficiency can lead you towards depression, and for that SSR and tranquilizers are given for treatment. But that's a different thing. But in your daily life, if you're feeling low or you have a mood swing, that does not mean that you're suffering from depression. It's just a environmental change due to which you are facing that kind of thing. So you have to be very clear with what kind of situation you are in. Depression can be hereditary also. So whenever you face depression or you are a patient of depression, you have to find out that either anybody in your family in past had depression or not. So stories will start from there. Now when we talk about GAD is generalized anxiety disorder. Anxiety is something like you feel uncomfortable, and like for example, a person going for an exam, you get scared, and your heart start beating very fast. That exam is there, and will I pass, will I fail, or these kind of things, thought process comes in your mind. People who have anxiety issues, their fear levels are so high that they will not attempt for it only. They will not go for it only. They will come out. Like for example, many children have anxiety issues related to exam. They are so scared with exams. They are very good in education. They are very good in studies. But when it comes for examination, they are very bad with that. They will not be able to apply for it. And whenever exams comes, it becomes very difficult for teachers and parents to make them sit and give exam. Most of them run away from that. So that is generally a anxiety related issue, and some people have so much of anxiety that due to some reasons or some environmental issue that they're not able to sleep. They start having headaches and they start panicking. They will have a lot of sweats and all, and due to which they get so scared and they get so uncomfortable that they are not able to attempt, or they are not able to do their regular task. Now when this is what an anxiety issue is. When we talk about GAD, that is generalized anxiety disorder, it goes beyond a regular everyday anxiety. So like I said, examination का मैंने आपको example दिया. ऐसे ही आप when you go for a presentation, you feel nervous, you feel scared, but when the presentation starts, you start giving your presentation, and धीरे धीरे you become normal, and you complete your the presentation. That's a normal anxiety. But like when the situation goes out of control and the person is not able to control, like I said, for exam, he runs away from the exam or she runs away from the exam without attempting it. That is what a condition where a person needs help for it. There are dedicated sessions by a trained psychologist, clinical psychologist, who help these people to overcome that kind of situation. Probably a mind deviation, probably a different kind of CBT or therapy is provided to these people, and PMR, like progressive muscle relaxation therapies, are done with them, with which they are able to overcome this kind of problem, and they are able to lead their they are able to compete with these kind of challenges and overcome them. Now when we talk about another aspect which is called as major depressive disorder, which is also called as MDD. MDD is a very common term when you go towards a psychiatrist or psychologist. They will always use these kind of terminology. So MDD is something which causes feeling of extreme sadness. You are extremely sad, you are extremely low, आपको कुछ लाइफ में अच्छा ही नहीं लगता, आपको ऐसी फीलिंग आती कि मैं दुनिया में अकेला हूँ. Some people like who goes through heartbreaks or breakup relation or divorce, separation, those kind of relations, they went through these kind of feelings. Or you prepared so well for a particular exam and you failed, so you feel like all these efforts I made, it went into vain. Then that is where you're when I talk about 1 to 10 ka scale, and out of that you're scoring 8 to 10, that is the heights of the sadness you're having in your life. And that kind of sadness is stretched from say 1 to 2 years to 3 years. If it is a 6 months, 7 months kind of situation and you overcame with that, that's nothing to bother about. But that kind of situation stays with you for 2 or more than 2 years, then it is called as it is a reason to it's a point to be taken for consideration. For that you need help in related to depression issues. So there could be for every reason you can be sad, and without any reason also you're sad. You just finding an excuse to become sad. So that is when that kind of situation comes in your life and it prolongs from for more than 2 years, then you should understand that you are undergoing some kind of depressive things in your life. There's something wrong in you with you. So for that you need help, and for that, like I said, you have to approach different kind of you have to find right kind of psychiatrist or psychologist for counseling. If it is a genetical problem, the psychiatrist will be able to help you. If it is a environmental based problem, then a clinical counselor or a psychological counselor will be able to counsel and help you out with coping strategies, and you will be able to overcome that. So now when we talk about another disorder which is called as OCD, that is obsessive compulsive disorder. आपने बहुत सारे ऐसे लोगों को देखा होगा जो परफेक्शन के पीछे भागते हैं. उनसे जरा सा भी एक चीज इधर से उधर, लाइक फॉर एग्जांपल देयर सम पीपल हु वाज वेरी ऑर्गेनाइज्ड. पेन एक जगह रखा है तो वहीं पे होना चाहिए, वहां से हट के दूसरी जगह आ जाएगा तो इट विल बी अ प्रॉब्लम. बुक एक जगह रखिए तो बुक वहीं पे रखिए, तो अगर वहाँ से हट के चलेगी तो इट विल बी अ प्रॉब्लम. दे आर पीपल हु आर maniac for cleanliness. If they find little bit of dirt in their house or in surrounding, they will start palpitating, they will start get panicking, and they will create some kind of nuisance. So if you see that kind of things in front you inside you or around you, you should understand that this particular person is undergoing OCD. There is no direct treatment for that, but there are therapies, there are ways by which this thing can be controlled. So basically OCD causes constant and repeated thoughts in person's mind. So like for example सुबह उठे और आपके दिमाग में आ गया कि सफाई करनी, तो आप बार बार यही सोचते हो सफाई करनी जब तक आप वो कर ना लो. और सफाई करने के बाद भी अगर वो सही तरीके से नहीं हुई कि ये ढंग से नहीं, एंड इट बिकम्स अ काइंड ऑफ इरिटेबल सराउंडिंग. So these thoughts happens with unnecessary and unreasonable desires to carry out certain behavior or compulsions. So many people with OCDs realize that their thoughts and actions are unreasonable. जरूरी नहीं है कि जो भी actions which they are taking or doing वो reasonable हो, या फिर उसके पीछे कोई logic हो. illogical भी हो सकता है. आपका घर पूरा साफ है, आपके घर में कोई गंदगी नहीं, फिर भी आप बिना मतलब के झाड़ू उठा के सफाई करने के लिए निकल पड़ते हो. So things like उसमें आप क्या लॉजिक सोचते हो? योर हाउस इज ऑलरेडी क्लीन, इट्स ऑलरेडी look fine, there's no sign of dirt, but still you think that it's in your thought process, nahi ye saaf nahi hai, mujhe aur saaf karna chahiye, and you will keep on doing this thing throughout the day, throughout the month, throughout the year, continuously, every day, every time. So this is this is a repetitive habit of that person, and without any particular reason, logic behind, you are just repeating it. So when you see this kind of situation, this kind of condition inside you or by around surrounding, you should understand that this particular person needs help, and this kind of behavior needs to be controlled. It cannot be treated, but it can be controlled. So for that, you need to identify it. So OCD can be related to one particular thing, or it can be related to multiple things. Like मैंने example दिया cleanliness के बारे में, कई लोगों को एक से ज़्यादा रिलेटेड चीज़ों के लिए भी हो सकता है, मल्टीपल चीज़ों के लिए भी हो सकता है, कईयों को सिर्फ एक ही चीज़ का भी हो सकता है. सो उसकी थेरेपी, उसका ट्रीटमेंट उसके हिसाब से होता है. नाउ व्हेन वी टॉक अबाउट PTSD is also called as post traumatic stress disorder. सो अगर आपके लाइफ में कभी कोई एक बड़ा हादसा हो जाता है, बहुत बड़ा हादसा कोई लाइफ में हो गया, जैसे आप किसी बड़े एक्सीडेंट, यू मेट विद एन वेरी बिग एक्सीडेंट एंड यू सर्वाइव विद दैट, बट a person with you, you were there, that person died. So it is a trauma for you. So, and it will stay with you for long, like you whenever you will drive, or whenever you come in a situation where you met with that particular accident, you will always have a thought that due to this activity that person died, and you get so much of scared with that kind of activity that you will not be able to perform that action easily in future. For example, like I said, you were driving and you're driving with your friend, you met with an accident, that friend died in front of you, and you survived, and that kind of stress came inside you, that whenever I drive I will meet with an accident, somebody will die. Due to that fear, you will not be able to drive ever again. So that kind of fear which converts into stress. So driving becomes a stressful activity for you. Why you're not able to drive? Because of your past driving issue, somebody died, and that fear will keep on will create a stressful situation in your life whenever whenever condition comes in front of you for driving, and failing to do that which you used to do in past will create a heavy levels of frustration in your life, and that will create such an impact that you will not be able to perform your daily or your regular activity for that particular day. So that is what a PTSD which I try to explain with an example. Now most of the people with us, about 3.5%, or say close to 4 to 5% people in India or in abroad suffer with this kind of situation. Everybody, most of us get some kind of traumatic experience in our life, due to which whenever we come into that situation, we are able to recollect that kind of situation, and we are people who are strong enough are able to perform that activity again. But people who are emotional, sensitive, and they're very emotional to that situation, or they get connected to that situation so strongly that it becomes very difficult to take them away from that. When you identify that this person is under that kind of situation, you should understand that this person needs this kind of help. So for that, when you are able to identify that, you should be able to take that person and convince that person and educate that person that what he is going through and what kind of help he needs. So there are different specialists for that. Mostly psychiatrists and clinical psychologists again will come in this to help these people around. With also counseling psychologists help, the person will be able to lead their life in a better situation. I will not say it will be completely wipe off from his life, but yes, a better and close to normalcy will come in his life when this kind of situation again comes in his life. Now, when we talk about another very important phenomena, which is called as schizophrenia, many authors like Sidney Sheldon or Robin Woods or different kind of authors have written n number of books on schizophrenia. There may so many movies have been made about schizophrenia. Some theories says it's a split personality. Some theories says it's a multiple personality. Some people think about this, but it is not like that. It is, schizophrenia impairs a person's perception of reality and the world around him. So he is not able to identify the difference between what is real and what is real. So the difference between reality and the illusion or delusion, he is not able to differentiate between the two things. When he faces, like many times he will sit and he will hallucinate in front of that there's somebody is in front of him talking to him, or he is talking or communicating to that person. In reality, that person is not there, is there in his head, and he is just hallucinating it, and he is or she is just assuming it that that person or that thing is in front of him, and it becomes so real for him that he is not able to differentiate that no, that thing is not there in front of me, and he tries to hallucinate it about. It's all about your thought process. It is generally genetic. So it interferes with their connection with other people. It also interferes with people, how he is able to connect with others. So they might experience, like I said, hallucination, delusions, and these can potentially put them in dangerous situations also if left unseen. So people who are suffering from schizophrenia or schizophrenic personality disorder, they need 24/7 person around them. They can hallucinate thing, and they can be harmful for them also. They can create a situation harmful for them, or can put others in harmful situation also. So it is very, very important that somebody should be there around and to take care of that. They cannot be left alone. So these can potentially put, like I said, if they are not there's no, like I said, there's no treatment for that. It's only a support system is there by which they can be taken care of. Now, when we talk about social anxiety disorder, there are different kind of social disorders. Like there are many people who are very scared of going outside their house. They cannot even keep their foot outside their house. The moment they start keeping going out, they start having panic attacks. They'll have sweating things, or they will be so scared that they may even faint also, or they will run inside the house. So when a person has an feeling of threat from everybody around him, that person is not able to socially connect with persons in physical manner. Like for example, I'm talking to you, other person wants to talk, other person is talking to me. For said people who are suffering from social anxiety disorder, that person, physical presence of that person itself will create a uncomfortable situation for that person. He will not, or she will not be able to will be comfortable in front of that. So it is also called as social phobia. These kind of people are very scared from from the world outside their house. Everything should be inside their house. Every thing what they are wanting must be inside their house. They must not go outside, and there should not be any situation that they have to step outside their house and do something required kind of situation. So it's kind of phobia for them, and people with social anxiety become very nervous when other people come around them. For example, I am a person who has SAD, and other person, like for example Palash has come to meet me. Palash has came and meet me and to just for greeting only. And the moment I see a Palash, I get scared. I get panicated. I get sweating. If it is in a controlled manner, fine. But if it is beyond control, that person either will go away or run away by seeing that person, or will do such an activity that the person in front of him will not come in future to meet him. So that kind of social phobia, phobic people will always avoid public gathering, crowding, meeting, events, everything. They will always be confined to their home. When you find that kind of situation with a particular person, that he is confined to these kind of things, then you should understand that person is suffering from SAD, and he or she needs a support system, understanding, not to misunderstand that person and understand his fear and concern about it, rather than making or piping stories behind his back. Now when we talk about, these are different disorders we spoke about. Now it is very important to know how should we deal with it, how should we cope with them. So these symptoms of many illness get worse if they are not treated. When they are not treated, when they are not identified, when you are not able to identify, or you're not able to point out that okay, these things are area of concern. A person is sad, nobody is bothered why the person is sad. They start assuming कि इसका तो sadness का attitude ये हमेशा sad ही रहता है. अगर आप ऐसा point of view लेके चलोगे, तो how will you help that person? You should understand what is the reason behind that. If there's no reason of sadness and still he is sad, you should understand that if without a reason also, if the person is sad or depressed or having a low energy level, or negative side of life, then that person needs some kind of treatment. So identification of a problem in this symptom is very very important. If you take it very casually in a normal manner, you will not be able to understand this thing. But if you see a repetitive kind of behavior and you overlook it, then it is a very big problem, and which is not the right thing to do. In this pandemic, you may find many of the people who went through many kind of situation where many people lost their jobs, many people lost their near and dear family members, many people had a very big loss in their business. They're going through mixed emotions. Whenever you turn on your TV, you find only a negative news around you, so much of negativity around you. And in that situation, a person's emotional and psychological balance do get disturbed. So it's very very important that whenever you see that a low kind of attitude, or low kind of energy, or low kind of symptom in that person, it's very important that you identify that and you try to talk to that person. If talking helps, nothing best than that. But if talking is not helping, and you're not going to you're not able to put him in a better situation, then it is very very important that you must convince that person for help, professional help. Reason could be anything: financial loss, or family loss, or any kind of business loss. But it is very important for that person to accept and to become strong enough to deal with it. Like in the beginning of the session I said, every problem does not have a solution. We must learn how to live with that problem. So if somebody has died due to some situation, we cannot bring that person back. He or she has to understand that he or she has to live without that person. Saying is very easy, but to convince him, to make him understand, and to live with that thing is very difficult. There's something called as grieving counseling, which many of the counselors do. and they try to help that person by doing that and bring that person back to the normalcy. So when you see that a person is extremely depressed because of someone's death or loss, and he or she is not able to come out of it, you have to identify, and you have to take to that person to that particular type of counselor, not to a regular counselor. So it's very important to identify first that what kind of situation it is, and when you identify that situation, do not leave the person in between. So you have to make sure that that problem is identified and the treatment not only started but gets finished also. Do not leave the treatment in between, because that will cause more problems. More problems will branch out from that. So it's very important that whatever the problem you're getting cured for must be observed and must be cured, and a proper termination of the session must be there. So for that I said, different situations, we need different counselor. When we suppose when we in lockdown have heard in news and other channels that a lot of abuse, domestic violence, and things happened in people's life. So because of loss of job or whatever reason, they became abusive, and they did lot of domestic violence in their respective houses. So it is very important for them, for the people around them, to understand that why that kind of abuse is happening and what can be done to stop it. It is everyone's responsibility, because doing an abuse and bearing that abuse both is happening, and both is happening because of psychological disorder of the person, or the wrong mindset of the person, or the way of taking out frustration of failure of one person or another person. So if the reason behind domestic abuse is frustration or any other things, there are other ways to cope up with frustration, and there are better ways which the counseling counselors will be able to help, and both the victim and the person who is doing abuse. So you have to identify that, and based on that proceed further. Like for example, there's another situation, husband and wife are having problems. They don't have linking in between, and they have some different issues, not abuse but different issues. For that they need, due to which they need, there are problems in their house. Their life is set upside down, and they are not able to live properly. They have a lot of stress in their lives. For that they need marriage counselors, who will be specialized in that, and they will be doing couple therapy to help these couples, and they will try their level best to find a midway out, so that situations can be under control. There are situations when siblings have problems, brothers and sisters have problems, brothers have problems, that things called as middle child syndrome, in which one child is the favorite child of the family, and the other things that all the attention is being given to that particular person, and others are other siblings are not neglected, due to which a lot of hater and lot of things gets developed inside them, and due to which a lot of problems comes in the family. When parents identify that, it is very important for them to take their child to a child psychiatrist or child specialist, and try to understand why that kind of negative thing is there in that particular child. And there is a different counseling sessions for them to help them to understand it is not like that. You are equally loved, and there is a perfect balance among all the siblings. But for that you need to identify first. You need to see your child, that why he is behaving, or why that kind of attitude is coming towards him, why he is so impulsive, or why he is so reckless, and why that kind of hater is coming from that. So it's very important to understand, keenly observe, and to your children and make them educate properly, and so that it's you will be able to identify and give a right help to that person at the right time. So this is what sometimes you need therapy, sometimes only counselings help in this situation. Now, how do you understand that a person is undergoing a mental health situation? So, like for example, a person is not eating properly, he is not having sleep proper sleep, he is not socializing with people, he feels fatigue, and and he does not have emotions. Any kind of situation you put through him, either he is very emotional or he is too practical and does not show any kind of emotions, or he has unexplainable body language, or he smokes drinks a lot, and then a lot of time he's not able to make decisions, and he is very very confused most of the time, and not comfortable only, and he starts hearing voices, he starts seeing, or she starts seeing faces which are not in real. When you these kind see these kind of situation things around that particular person, you should understand that this person is undergoing the mental health illness, and he or she needs help. So it should not be ignored. So how will you diagnose that a person, you have seen symptoms, these symptoms can be visible to for a normal disease also, of normal and so on. I mean, if you're suffering from fever also, sometimes you don't feel like sleeping. If you're having a prolonged disease, you may have eating disorder, you may have different kind of things. But how will you identify that these symptoms are related to mental health illness and not other disease? So for that, a proper diagnosis is required. There are different tests are done, there are different techniques, and open end and close end questions being asked from the patient, by which a proper diagnostic sheet is prepared. If a person goes to a psychologist, a clinical interview is taken from that person to identify that what kind of situation a person is coming from, and how should that will give an idea to a psychologist or psychiatrist to start a way with that person. So it's very very important for a person to understand, psychiatrist to understand what situation what situation the patient is coming from, and based on that a proper diagnostic channel should be prepared. Now, how treatment can be done? Treatment can be done by medication. Treatment can be done by therapy. If the condition involves like psychosis, or schizophrenia, or bipolar disorder, or MDD, these kind of situations are there, and at that situation, SSRs and tranquilizers are required for a regular a thing, and this things comes under medication, which are these kind of medicines are given by prescribed by only and only by psychiatrist, and under the supervision of clinical psychologist. The training, the sessions are taken by that. So medication part will be done by the psychiatrist, and the counseling and other part will be done by the clinical psychologist. Now when we talk about psychotherapy, the psychotherapy, like what we are doing, that talk it out theory, which is a very common therapy. Second we do is cognitive behavior therapy, CBT. Other normal therapy which we apply is PMR, progressive muscle relaxation therapy, in which normal exercises are being prescribed to people, and by doing that they became healthy and normal. So इसके बाद भी, if the treatment, if the person is not getting cured, then a proper hospitalization is done, and their dedicated nurses and staffs and psychiatrists and psychologists, all kind of different psychologists will be there, and they will be taking care, and situation by wise they will be able to give the right medication and do the right counseling under a proper supervision of a trained psychiatrist. So these hospitals are not general normal hospitals like we go about. They are called as residential hospitals. So residential is something like a big area society kind of place where all these mental illness patients stays, and they're taken care of in a very cordial and very sophisticated and sensitive manner, keeping mental health guidelines and policies in mind. So these are residential places. These are like colonies. These are kind of normal houses where people will be staying, and proper treatment will be taken care of them. But yes, due to the situations, they will not be able to stay in their regular houses and with their families. Their situation is that critical that they have to stay there. Now other things is that some diseases which are mental illness, like they can be treated with changing their balancing their lifestyle and some home remedies. So like for example, if you are not able to sleep properly, you have sleeping problems, you try to deviate your mind, do an activity by which you feel by which you can feel sleep. Like for example, I used to have sleeping problems. So there was a subject, history, in my life I used to hate. At the moment I used to study it, I used to feel sleepy. So whenever I don't feel sleepy and I feel insomniac or some thing, and I'm not able to sleep properly, I used to pick up any kind of history or the most boring thing which thing which of least of my interest, start reading that, and due to which I used to fall asleep. That is the way of my coping. Like that, there might be different activities in people's life which can be inculcated in their life, due to which they can overcome this insomnia problem. At the same time, medications or medicines will be given. Proper exercise like yoga and yoga exercises or meditation exercises or PMR exercises, if the people are doing regularly on the basis, with on time eating, on time sleeping, on time getting up. So when they are able to do that with proper medication, they will be able to lead their normal lives at the same time, with the strongest support from their families. Now this is what about that. And like I said, there are different exercises which a person can do. I will talk about three major practices, exercises which people do or recommend. One is striking a power pose. So people who use power poses, that is hands and hip, may see a temporary drop in feelings of social anxiety. So people who are having a problem related to social anxiety, they can use this striking a pose exercise, and by doing that they will be able to control their social anxiety. But that does not mean that कि आपने एक दिन में कर लिया और उसके बाद आप नहीं करते, या फिर आपकी प्रॉब्लम सॉल्व हो गई तो you stop doing that exercise. No, you have to make that exercise a part of your life. And then now when we talk about second, listening to calm music almost हर बीमारी का हल है, बट राइट सिचुएशन में राइट म्यूजिक होना चाहिए. अगर आपका सर दर्द हो रहा है, आपको नींद नहीं आ रही है, और आप ट्रोमैटिक सिचुएशन में हो, या फिर आप यू नॉट इन अ कंफर्टेबल जोन, और आप रॉक म्यूजिक लगा दो, या फिर आप हल्ला गुल्ला वाला ज़्यादा म्यूजिक लगा दो, या शादी ब्याह वाला म्यूजिक लगा दो, you will have your life will be more miserable. So at that situation अगर आप calm music and calm and composed music सुनो, like flute voice or any instrumental song or any calm like ocean water song, any calm and composed music is around, your stress level will reduce and you will feel better. So listening to a calming music will always and always help you, and help you to reduce your problems, not increase it. But like I said, right music for right mood. So if you are in a happy mode, fine, you can go ahead and listen to rock song and all kind of making a noisy song. But when you're not in in a good situation, you're depressed, you're sad, and you're not happy, and at that time, if calm and composed music is around you, like for example waving of water, waving of air, or soothing poetry, or soft song, or just an instrumental around you, you will connect to that, and probably you may get sleep and you will feel better also. The another thing is that, like I said, PMR exercise, progressive muscle relaxation exercise, is the combination of your muscle and breathing exercise. You will you under a trained psychologist or yoga specialist, or a PMR specialist, when you do a 15 minute morning exercise and 15 minutes evening exercise with a combination of muscles and breathing, your stress level will be reduced, your blood circulation will be increased, and blood circulation will be better, and you will start feeling better. So we always say that whenever you are in a stressful situation and you have high level of stress, just do 15 minutes PMR exercise, and you see the difference before and after, and you will feel better. So to understand more about PMR, you can anytime open YouTube and just type progressive relaxation muscle therapy, and follow those steps for 15 minutes in morning and 15 minutes in evening. You will find a difference, and you will feel better, and your life will be better. Even you don't do any exercise in a day, in throughout the day, fine, but if you do morning and you spend morning 15 minutes and evening 15 minutes before food and before lunch, you will that is good enough for your hormonal and your blood circulation, and that will improve your life and things better. So that's one thing. And apart from that, if you're able to find time for doing yoga, then it's best. Yoga is one of the best exercise, but depending on your condition, what kind of yoga you can do under proper under the guidance of doctor and yoga specialist, it's better to do. Everybody has a different body posture, everybody has different kind of problems. Like for example, I have ulcerative colitis, I cannot do surya namaskar. I have problems. If I do surya namaskar, it will not help me, it will create more problems in my life. So it is very very important that if you are doing a yoga, first get to understand your body, what you can do, and take a guidance from a proper professional person, and as per your body go ahead. Because there are many people who do a lot of stretching, bending, flexibility. They mix yoga with gymnastics. It should not be there like that. Doing gymnastics is different, doing yoga is different, and every asana is not for everybody. If you're perfectly healthy, if your doctor says that you can do these kind of exercises, fine, go ahead and do it. But if you have a prolonged disease, if you any kind of disease you are having, or any kind of problems in your life, it's always better to consult a doctor and then go to a yoga practitioner and to get a proper chart for the exercises which you can do, rather than doing a random yoga exercise, or rather than doing in random exercises. So it's always better that whatever exercise you do in your life related to yoga, meditation, or PMR, before doing that, understand your body, and then take proper guidance from a doctor that can you do this exercise or not. Will it will that asana will benefit you or not? Based on that, go for that. Else do a normal exercise, normal meditation, or normal breathing exercises. That will always better. So now when we talk about mental health recovery, so it can, depending upon the kind of disease you're having it, and the severity of that disease, it may take time of 1 month to infinite, till the time you live. So depending how you cope up, how you blend with your psychiatrist or psychologist, how you follow the instructions, you take medications properly or not, based on that the treatment health recovery happens. There are certain diseases like Alzheimer, or there are some certain disease like OCD, or different diseases which does not have a cure. No matter what you do, you will have that disease with you, and with time they may get worse. But with the professional help, you will be able to live better with that, because you will understand that this is going to happen, and this is how you are going to deal. So there will be two kind of therapy for these kind of people. One, for the person who is having a mental illness like Alzheimer, or different kind of problem he's suffering, and the people who are the caregiver will be trained properly, that how they are supposed to deal with these kind of patients, and what kind of probable situation. Like for example, for the worst Alzheimer's patients, they may even have a situation that they forget to take breathe, they will forget to take food in, they will eat food but they will forget to swallow inside. Like these kind of situation will happen. So the caretakers will be trained as per that, so that they will be able to help that person, and they will be able to come up with an idea, so that the person should not get lost when they go out, or some address or some chit should be there in that person, so that if he is lost somewhere, so somebody will be able to take that slip and address and will be able to drop like that. This is one example I said. Other kind of things people can do to train these kind of patients. There's specialized dogs and animals who are trained in taking care of such people. Like for example, there are professional trained dogs to take care of autistic children. So like that, there are different ways by which the people try to train the caretakers also. So it's very important. And then there are different behavior therapies, and there are different cognitive therapies by which the psychiatrists try to help the not only the patient but also their family members. So now when we talk about mental health awareness, so it's like I said, the more and more we study about it, the more and more we discuss about it, the more and more we connect, and we don't shy about talking about these topics. And because mental health is just an overview I'm talking about, it's an ocean, there's so many things inside that. So mental health is just not related to your mental status, there's also related to different things. So it could be substance abuse also, it could be alcoholism also, it could be drug abuse also, it could be porn addiction also, it could be child abuse also, it could be different issues which can be related, which can cause mental health illness. So it's very important that you get more aware about it, you more talk about it, you don't feel shy about it, you don't feel low that if by asking help. So you need help, so you need to ask for it. Nobody is going to understand, nobody is god that he will, by just seeing you or him, that person will understand that you are undergoing through it. It is very important for you to identify, first self identify that you are undergoing a problem, there is something wrong inside, and to correct it you need help. Unless you will accept this, you will not be able to go in a right direction. So it's very important, first learn, accept, and then ask for help. So that is, and this will happen by creating more and more talks about mental health, different kind of issues, different kind of understanding what people go through about it. Calmly, patiently, you have to listen to the person who's suffering. Do not interrupt the person, let the person speak completely, let him take his all inside out. and once it's out, he or she will definitely feel better. So that's one thing. And with that, I will also tell that many of us are parents and they have teenage children in our house. And people, as you know that when a kid hits 13, he is teenager. 13 to 18 19 years is a very crucial period, and in that period there are so many hormonal changes happen, so many things happen. A proper personality of a kid, of a child, is in confusion. What he is going to do, and he is completely different, or she is completely different from an adult and from a child. So there's a very famous poem by Shakespeare called as Child or Adult. So to understand a situation of a child or adult, you can always go back and read that poem. You will be understand what a teenager goes through and how he understand or things. So with these emotional changes and with these hormonal changes, so many things happens inside that teenager, that he develops so many mental issues, and he will always in a defense mechanism means that he will always try to safeguard himself. He will always try to prove himself right, others wrong, because he will not be able to understand why other people are trying to stop him or her for doing this because of experience and all. They will name it as a generation gap, or they may have a completely different opinion of life in comparison to adults and children. So if it is very very important as a parent or as an elder brother or sister, you try to understand what kind of changes your the teenage son or daughter or brother or sister is going through, rather than rebellious, rather than be a very strict or imposing thing over them. Try to understand their situation. It's just not this environmental situation, it's the hormonal situation also. And try to be friendly with them, and try to understand and be friendly with them, and try a way with which you will be able to connect with them and understand them, because you were also a teenager once, and from that age only you have come to adulthood, and you are with those experience only you are somewhere a knowledgeable person. So they are also in the same path, and you have to understand, support from them. I do not say that support in their wrong do's or support in their all says, but try to understand a logical reason behind that, why this particular child is doing or behaving in this manner. Once you understand that, and then when you do that, you try to solve the problem in a politer manner, rather than in a very making things very complicated and stick to the rule kind of situation. It must not be like that. So these kind of things you have to go, because teenage situation में ही आपकी पूरी schooling हो जाती है, पूरा graduation की starting हो जाती है, बच्चों में अपने एग्जाम्स के टेंशन्स होते हैं, करियर के टेंशन्स होते हैं, फ्रेंड्स के पियर्स प्रेशर्स होते हैं, गर्लफ्रेंड बॉयफ्रेंड के इश्यूज होते हैं, बहुत सारी चीज़ें होती हैं विच अ चाइल्ड इज़ गोइंग थ्रू. एंड इट्स नॉट इम्पॉर्टेंट दैट कि मतलब हर एक प्रॉब्लम का सोल्यूशन बच्चा जैसे छोटा होता है तो ऑब्वियसली पेरेंट्स के पास जाता है, बट व्हेन दे आर इन देयर टीन्स दे विल पेरेंट्स विल बी देयर लास्ट रिसॉर्ट टू रीच. So you have to be in that situation, that friendly, that your child must be frank enough to walk to you and ask for help. बट अगर आपने एक बहुत ही स्ट्रिक्ट सा जोन बना के रखा है और बहुत ही कॉम्पैक्ट सिचुएशन बना के रखी है, वेयर हेड ऑफ द फैमिली से समथिंग, दैट विल हैपन ओनली. Or one parent has said something, that thing will happen only. There's no say of a child. It should not be like that. It should be a cordial situation. Everyone must have a say on that, reason to put their or his or her view in front, and based on the logical reasoning, a decision should be taken. In that, when a child enters in a teenage, he must or she must be included in the decision making process. He must be included what is right and wrong. He must be included in the decisions related to his career or for his growth or things. Because if you are not, most of us, most of our parents want their children to be, doctors and engineers only, which gives a lot of stress and what a lot of problems in their lives. Because many of the people don't want to be a doctor, they don't want to be an engineer, they want to do a simple graduation in arts, or somebody wants to do animation, somebody wants to do painting, somebody wants to do so many things. But only emphasis are given in few professional courses. It should not be like that. They must see that what exactly their child want, and based on that they should motivate the child to do that kind of take that kind of education. They should not stress or overburden that that you have to do this only. No, there are different people in the world who are successful in not doing a doctorate or engineering. There are many good novelists, there are many good writers, or there are many good bridge makers, or different situation businessmen. There are different streams in which people have make their names. There, everybody is not doctor. Just go to any MNC, you will find most of the engineers doing non-engineering work. I myself an IT graduate. I never I never got an opportunity to do an IT coding kind of work. I got a managerial job, I got a sales job. My first job was sales and engineering has no clue, no relation. So it's just comes in the mind of parents that engineering and doing MBBS or those kind of courses will lead you to a good job and all. No, not like that. Many of the engineers are doing managerial jobs. Many of the doctors are into hospital management, or they're IAS officers, or they are they're in the film industry or somewhere. It's nothing to do with that. Pick a education, allow your child to be free enough to pick a course which he or she wants to do, and support them, rather than stopping or holding them. Like, you have to do this, or you have to you have to become this only, or you have to it should not be like doctor's child will be doctor's, engineer's child will be engineer. A doctor's child can be engineer, engineer's child engineer father can have a doctor daughter also, or doctor child can have an architect son also. So it's something like that. So there are you for that you have to understand the psychology of your children, and based on that support them. So these are the things about I had pointed out in just an overview sketch of mental health. And with that I will conclude, and I would like to know if anybody has questions on that. Hello. Hello. I'm open for questions. If somebody wants to ask questions, we can go ahead with that. Typing, I will not be able to see. If somebody has question, they can open their mic and then can ask. Hello. Hello. Thank you, Mahesh. I would be more glad and happy if somebody can ask questions on that, please. Over to you, Mahesh. If you want to say something, you can turn on your camera and can say. Okay. So you can conclude, Mahesh. So, guys, I have a YouTube channel as well. You can search me by Dr. Amit Flora. There is a international presentation and research on mental health education. You can feel free whenever you want to see it. It's free of cost, and it was present. It came in. It was nominated as in under Guinness World of Record presentation of 150 hours also. And whenever you get time, please do have a look. It has a comparative study of different mental health illness, and that will I'm sure that will give you more insight on that. If anybody has any doubt related to that, they can always come back and ask to me. And apart from that, I am also a known author, and at present I'm working with ESN Publication and IMRF, and in on 26th and 27th, my live talk will be there in Red Talks on coping with frustration. So whenever you get time, you can always go there and have on Red Talks channel. You can have a look on my presentation on frustration cycle. And apart from that, my book on Cybro Psycho Management Tech Management book is going to launch on 23rd April 2022, which will have many articles related to psychology like parenting, child abuse or mental health issues, apart and cybro psychotechnological related topics will be there. Among anybody, if anybody is interested, they can reach to me, and I will be happy to include their article or their knowledge in that book. So tomorrow also, I and Mahesh is going to have a live session, and that session will be on depression. That topic will be completely on depression. If you guys are interested, please do join us at the same time, and I'll be more than happy. And there also you can bring few questions, and we can try to discuss about those questions and find out our ways. Thank you, and I would like to end.